Hi, do you feel embarrassed or uncomfortable when talking about breasts? Now, this is a very common problem in India, and it's a risky one because this embarrassment and this guilt is actually costing lives. Women don't go early enough to their doctors when they find a lump in their breasts. Hi, I'm Dr. Nilima Deshpande. I'm a gynecologist and a sexual medicine expert and an expert in menopause care. In India, we know there are millions of women who get diagnosed with breast cancer every year. The mortality rate of women in India is much higher than the Western world, partly because women don't go early enough to their doctors. They don't know enough about their own breasts, about what their normal breasts feel like. Self-examination isn't encouraged as much in our country as it is in the West. And because they're unfamiliar with what their breasts feel like and look like, normally, if they're late in recognizing if there's a problem or if there's some kind of change in the appearance or the consistency or if they feel a lump. And many times breast cancer lumps have no sensation or they may not have any pain. Many women feel that only if something hurts you're supposed to go to the doctor, so they delay going to seek for any kind of help or treatment. We know that in breast cancer, early diagnosis and treatment, particularly surgical treatment, is the mainstay. Surgery is often followed by chemotherapy or radiotherapy. Many times women delay going to a doctor because they're afraid of surgery. They're afraid of losing a breast. And this means that they often waste time looking for treatment on the internet or, finding some mantras or crystals or maybe some herbal remedies which don't necessarily help them. They delay diagnosis and treatment of the breast lump. And in breast cancer, we particularly talk about 5-year survival rates. And the later that the lump is diagnosed and treated, the shorter the 5-year survival rate of breast cancer is. So it's very important to go early to the doctor if you find a lump. Number one, to get it assessed, examined, and to find out if it is or isn't cancer. The typical age for breast cancer is actually between the ages of 35 and 65. But that doesn't mean breast cancer doesn't happen in younger women or in older women. Any lump in the breast should be taken seriously and assessed as soon as possible. Some women are at greater risk of having breast cancer, and these may be some of the following. Women who've had very early periods, so for example their period started when they were 10, 9 or 10 years old, or those who've had a late menopause, they're still having periods even when they're 52 or 53. Women who've had children but who haven't breastfed, or women who've never had children are also at slightly higher risk of developing breast cancer. Women who've had long periods of hormone therapy or maybe long periods of estrogen even after the menopause in an attempt to treat menopausal symptoms, the risk of breast cancer does go up slightly in these women, though not to a great extent. Women who smoke, drink alcohol, are obese, are diabetic, have a much higher risk of breast cancer than other types of women. Breast self-examination used to be promoted a lot until quite a few years ago. Recently, it hasn't been promoted so much, but I still do. I believe that it's really important that a woman learns to self-examine her breasts, not necessarily to detect lumps, but to actually recognize what's normal for her. Many women don't know how to self-examine themselves. So I would suggest that there are several videos on YouTube that teach women how to examine their own breasts. And if you're in doubt, go to your gynecologist or your doctor and learn how to examine your own breasts so that you know what's normal for you. I would also suggest that men learn how to do this because men also do get breast lumps and breast cancer. So men should also pay an attention to their own breasts and learn how to check them out and examine them and see what's normal for them. Any change, and do seek help from your doctor, don't delay. Some of the things you can do to reduce your risk of developing breast cancer is, if you're obese or overweight, get your weight down. Obesity is linked with breast cancer because we know that fat cells also are responsible for increasing your circulating estrogen levels, which are often linked with higher breast cancer levels. Reducing the amount of alcohol you drink and stop smoking. These 3 things you can almost immediately action to reduce your risk of breast cancer. If you've never exercised, increase or start If you have never exercised, do start exercising. Exercising is one of the most important steps you can take to reduce your risk of many things, not just breast cancer. In your diet, make sure you cut out all processed food. In the current scenario, in our food chain, we have a lot of chemicals, whether they come from pesticides or cleaning products or plastics. And a lot of these chemicals are called endocrine disrupting chemicals. And endocrine disrupting chemicals do upset the hormone balance in your body and are responsible for increasing risks of breast cancer in populations who are having a higher intake of processed foods. So cut out the processed food. Now, what kind of doctor should you see? If you do find a lump that you don't know, you're unsure about, you're not very confident, you may or may not have some nipple discharge, you may or may not have a lump appear in your armpit, you may find that the lump is not very big, it's not very uncomfortable, but it's still there. I would suggest still go and see your doctor. Let the doctor decide whether it's something to be worried about or not, and whether any further investigation is needed. If in the sad circumstances that you do get diagnosed with breast cancer, remain you're not unsupported. Your doctor will have a team with them, a psychologist, they'll have a clinical oncologist, somebody who deals with the chemotherapy and the radiotherapy aspect, and also someone you can openly talk about your quality of life, your intimate relationships, how to maintain conversations at home about the cancer process and the diagnosis and treatment and the upheaval it might cause in your life. Don't forget to talk about your intimate relationships and how you can resume having an intimate relationship even after breast cancer surgery. Having sex does not upset your hormone balance or worsen your risk of breast cancer. So this is really important. Remember, you are not going to be alone. Remember to talk openly without any blame or shame or guilt. Talk openly, discuss your concerns, and get answers to your questions. Don't sit at home and be depressed or anxious or upset because your questions haven't been answered. While you're going through this process, journaling, it can be a very useful tool. It can help you document your highs and lows and help you to learn from what things worked for you and what didn't. What I feel is important at this stage is also making sure that as a woman, you disseminate this kind of knowledge with other women in your group. Make sure nobody gets left behind. Nobody in our country should die of breast cancer because they were too ashamed or too guilty or too fearful of telling somebody. Make it easy to talk about, Make sure that the women in your family feel supported and feel open and feel able to talk to you about their breasts, about their breast health, and know what kind of action points they can take. So do share either this video or your understanding from this video about how to look after their breasts. In your family, encourage openness and non-judgment about discussing breast health. Even if there are men there, men also get breast cancer, men also develop breast lumps, so they should know about this as well. Every individual needs to understand their body and different parts and how to look out for changes that might signal that something important is happening. So I hope you found this video useful. Do go ahead and write down your learning points and pledge to warn and encourage the women in your family to share with openness and without judgment how to look after their breasts. Bye, until next time.